Hi, welcome to another of the CODStream short videos on telehealth and why it can be effective in your practice. This video is talking about the setting and what we need to do to make it work. It's kind of a high-level technical sort of overview. Privacy and HIPAA concerns are still valid and apply to telehealth. The laws in the states vary, but one of the ones that is absolutely common is the same quality of care standards that apply in an in-office visit also apply online with doing the telehealth. The same HIPAA security requirements apply to telehealth. That's one reason why you need a platform like the CODStream telehealth platform. It is HIPAA compliant, it's high-tech compliant. It meets all of the standards for encryption so that the items meet and pass muster on all of these regulatory agencies. It's something that you can tout with your patients that it is secure. There's a reason that people can't use Skype or use FaceTime because those folks can never get the HIPAA certification. We need to have a business associate agreement that all of the controls are in place. That's what the provider signs with CODStream so that the provider can feel comfortable that all those things are being met. It's an ability to say this has come of age. Now, when you're talking about the equipment that you need, one of the goals that CODStream has was to get a platform that was not dependent on high-cost equipment. A laptop or a desktop for the provider will give you the best experience with this. Having a screen of 13, 14 inches or bigger is very, very helpful on the provider side. You need a camera. Most laptops come with a webcam and a microphone. Those are essential. Personally, I'm using a Logitech HD camera. I like it because if I move, it'll actually track me and move with me, and it'll focus and autofocus and stay on my face. It also has a microphone built in. In fact, I'm recording this video with that microphone. And the absolute best part of it is you can pick them up at Best Buy for $39, or if you're an Amazon person and you're watching the sales, you can get them for under $30 if you're watching the sales right. So it's a low-cost item, and I'm using that as an example that this is a low-cost platform. And because of your CODStream membership, you're not paying for any of the software. CODStream has already handled that, and that's part of your benefit of being a CODStream member. Now, what that means on the patient side is you have less control. Now, they're going to get the best experience as well if they have a desktop or a laptop to do it. But it's also configured that it can handle any smartphone. It can also handle tablets. And depending on the screen size, the quality of the experience can be related accordingly. In most phones, the screen space is limited. And one of the practical problems is that in this kind of conversation, I use my hands a lot, as you may be able to tell, and a lot of people do. But if I've got to keep the phone in my hand focused on my face, that can be a difficulty. Be a difficulty, especially with things like speech therapy. If I'm watching the patient's mouth, looking for articulation and how the muscles are working, having that held up is difficult. Having a kid that I'm delivering the therapy to can be really problematic if the kid has to hold the phone or the tablet in their hands the whole time. So even with those folks, that's one of the best things is just using the laptop with a nice HD camera that gives me high definition so I can see what it is. And for the $20 to $30 or $40, it's a great investment. The other thing is that I need to have a private location. You've got to have a spot, just like you would not engage in therapy with an open door in your office where people walking by can see in and over here. You need to have a private place. That means don't do intimate therapy at Starbucks where you're having people over here. Get a nice room, with a nice setting that's quiet that you can engage with. Extremely helpful. A lot of people like to use headsets. Headsets can be good. If you've got ambient noise outside, you've got the dog that barks outside the door, putting on your headset with the microphone cuts a lot of that. That's a personal preference. I've explained what mine is to you here, and but it's open to any of that equipment, and the cost is relatively nothing. So when you're picking the setting, all the same rules of privacy apply. The same rules of finding a good location. It can be at your desk, can be on your couch, making sure that it's one that you're not going to be interrupted in, where you deliver the services through. But we encourage you to keep finding those spots, try the therapy, find the things that work for you, and find the things that work for your patients.